Good morning, everybody. Welcome. Just a quick sound check as you're joining. Can everybody hear me? Yes? Good. We've got, let's see, it looks like 17 people in the room and others who are joining. We will jump in and get started in just a moment. Anybody joining us from faraway places, exciting places? Feel free to unmute yourself while we're waiting for folks to join. Well, maybe Larry Clark is joining from the furthest, most exotic place, up in the Pacific Northwest. Larry?
From Seattle.
All right, so maybe you win the award.
Maybe.
I'm zooming in from Chicago. All right. Well, in the interest of time, and we want to make sure that we get everybody on their way today on time, why don't we jump in and get started? I'd like to welcome all of you officially. My name is Michael Oxman, and on behalf of the Patterson Foundation, delighted to have all of you here today. I'm one of the managing partners and principals at a consulting practice called No Margin, No Mission. And that guy named Larry up in the Zoom box who was just talking from the Pacific Northwest is also one of the managing partners and principals at No Margin, No Mission. You'll hear from him in a little while, but I think with that, if I can share my screen, we'll dive in and get started with today's session. So this is the first of our CEO series, which we're calling Discussing What Made Their Earned Income Ventures Thrive. And it's part of an initiative at the Patterson Foundation called Margin and Mission Ignition. And we want to make sure that you have some time today after you've heard from our first CEO guest speaker to hear about how your nonprofit can participate in this thing called Margin and Mission Ignition. More on that in a moment. So the CEO series is going to consist of 4 separate sessions. Today is our inaugural session. So again, each of you have chosen to join us because you likely have an interest in hearing about launching a transportation service called Sunshine Wheels. I'm going to introduce our guest speaker in just a few minutes, Carol Fitzgerald. And after today's session, we'll have 3 more. And I believe that a number of you have also registered to join us for some, if not all, of those other sessions. And if you haven't registered for those sessions and you'd like to, you'll still have the opportunity to do that. Before we go much further, I'd like to introduce Rachel Henninger. She's one of the fellows at the Patterson Foundation, just to share a few Zoom housekeeping items. Rachel, are you there?
Yeah, hi, Mike, I'm here. Thank you everyone for joining us today. I just want to remind you all to stay muted throughout our presentation, and you're more than welcome to pop questions into the chat and we will address them at the end. If you could rename yourself with your name and organization, like our speakers have done for you today, or go ahead and pop your name and organization in the chat along with anyone else who might be joining you from your organization, that would be great. And we will respond to as many questions as time permits during our Q&A at the end. And just a reminder that this session is being recorded and will be sent to you in our follow-up email.
Great. Thank you, Rachel. So our agenda today is simple but action-packed. We're going to start with just a couple of introductions, share a little bit of context about why we're here today, and then, of course, we will turn it over to our guest speaker. You'll hear quite an interesting story from her about her organization's earned income venture. And then we'll wrap today's session by talking a little bit about Margin and Mission Ignition, what it is, and how your organization can participate. Of course, we will have time for questions and answers during the session. So as we're going through and sharing today, please feel free to jot any questions down or comments that you'd like to share, either, as Rachel said, in the chat box or on your notepad, and then we will take time to answer those questions. So about the Patterson Foundation, I'm pretty sure that most, if not all of you, are quite familiar with TPF, but just in case you're not, the Patterson Foundation strengthens the efforts of people and organizations and communities, in particular in the four-county region in and around Sarasota. You're likely familiar with a number of their initiatives, not the least of which are the Giving Challenge, Suncoast Campaign for Grade Level Reading, Digital Access for All, and Patriot Plaza. If I could pause for just a moment, I'd like to just acknowledge our colleagues who have joined us from the Patterson Foundation today. Michael Corley's with us. Michael Zimmerman is with us. I believe I saw Connor LaGrange with us. So Connor, if you're there, you can wave. And of course, you met Rachel Henninger. Stacy Sternberg, I think you're here as well. So thanks to all of our friends at TPF for joining us. One of the initiatives that the Patterson Foundation undertook almost, I guess, 8 years ago is an initiative that we call Margin and Mission Ignition. Some of you are familiar with it. Others of you may not be. But it is one of the thrivability initiatives at the Patterson Foundation that helps nonprofits boost their revenue and mission impact, specifically by launching or growing an earned income venture. So you may ask, what is an earned income venture? And just to ground everybody in sort of our definition of it, an earned income venture is an enterprise that generates revenue from the sale of goods and services. And the good news about an earned income venture is that it provides unrestricted income to an organization. And those activities can be related to your mission or unrelated to the mission. But I think for purposes of what we'll be sharing today, we much prefer when your earned income ventures are mission aligned. They just tend to be stronger and to create what we believe is more impact for your organization. And also, just to be clear, an earned income venture or earned income is not grants and donations. So oftentimes when we talk with folks who are affiliated with nonprofits, they may think that grants and donations are earned income, which they're not. So there are many, many, many examples of earned income ventures. The good news is that the possibilities are essentially endless. They could range from a behavioral clinic to an art and supply store to a community theater, educational training, veterinary services, literacy training. You could have a low vision store. You could offer recreational horseback riding. You could have a store in your school. You could have a senior daycare center, a thrift store, venue rentals, and the list goes on and on and on. It's really one of the wonderful things about earned income and earned income ventures is that the possibilities are endless. We do believe that the best earned income ventures, as I said a moment ago, are ones that boost the revenue of your organization and increase the mission impact as well. Ultimately, we hope that as each of you think about earned income and your earned income ventures, that it will take you well beyond survival or sustaining and into what we believe is an organization that thrives. And again, earned income is one of the ways that you can help your nonprofit organization thrive. So in keeping with that, we like to share this quote. We attribute this to ourselves, myself and Larry. The best part of a nonprofit's revenue pie is the big slice that's filled with earned income. And if you, as nonprofit leaders, haven't taken a look at your organization's revenue pie recently, we urge you to do that. see where earned income fits in. Is it a small slice, a large slice, or maybe there's no slice at this point? We'd like to pause for a minute and introduce our first Zoom, well, I guess our only Zoom poll question, just to get a sense for where each of you and your organizations are at in terms of earned income. So I'm going to ask Michael Zimmerman to launch the Zoom poll.
All right, here is our first Zoom poll question. It is, how would you characterize the role of earned income in your organization today? So everyone, if you could take a moment to select one of the three options here, we'd appreciate it. And I see some results coming in. Okay. All right, I see a couple more folks just need to answer. We're almost there. All right, we'll give everyone another 5 seconds here, and then we'll launch our results and turn it back over to Michael Oxman here. Hold on. Okay.
All right, thank you, Michael, and thanks to each of you for your responses here. This is nice. We've sort of got a almost an even distribution between the three responses. I guess the first one has a slight edge. It's a priority, and we're always looking for opportunities to expand and grow it. But regardless of how you answered this question, the good news is that what we have to share with you today will be relevant to each and every one of you. So with that, I'd like to introduce our guest speaker. Her name is Carol Fitzgerald, and she is zooming in from the greater Hartford, Connecticut area. We had the good fortune of meeting and working with Carol and her organization starting in the fall of 2018, hard to believe, so almost 4 years ago. And you may wonder, why is a CEO from an organization in Connecticut joining us for this session? Well, the answer is that it all goes back to the Patterson Foundation, and I'll tell you why. Because after kicking off Margin and Mission Ignition, this initiative almost 8 years ago, we got to a place where it became such an interesting initiative, and one that other foundations and philanthropies were interested in bringing to their communities. So the Hartford Foundation for Public Giving said, we want to bring Margin and Mission Ignition to the greater Hartford area and offer it up to our grantees. And Carol and her organization were one of the original organizations that participated in that initiative, which is called the Social Enterprise Accelerator. So without sharing too much, I'll just say that Carol and her team from New Horizons have done some fascinating work to bring an earned income venture to life. I don't want to reveal any more than that, other than to say, Carol, thank you for joining us today. We're delighted to have you here. And I'm going to turn it over to you to say hello and share your story.
Thank you, Mike. Good morning, everybody. Thanks for having me. I'm always very excited to talk about our social enterprise and frankly, how successful it's become and how much it means to New Horizons. I really want to thank the Patterson Foundation, because I know they led the way to supporting nonprofits in earned income ventures, which led to the Hartford Foundation offering their program, which we were so lucky to be part of. So we've been on this earned income journey. How did it start and why? We've been working on a development plan to really diversify our revenue sources. New Horizons is funded primarily, or was funded primarily by the state of Connecticut, Department of Social Services, Department of Public Health. And we felt that we wanted to be broader. We all know how relying on government funding can be a problem when their purse strings start tightening. So we were looking for funds to bridge the gaps for when there were frozen rates, et cetera, through the state of Connecticut, and thought that an earned income venture made sense for us here. I just like to kind of tell you a little bit about us, I guess. What's our mission? What do we do? So we provide a continuum of care, all the way from a skilled nursing facility, which is our Cherry Brook Healthcare Center, just what you would expect, through New Horizons Village, which is housing with support services for people with physical disabilities, support services such as recreational transportation, backup medical care. And then we have just apartment living at our New Horizons Middlebury that is truly accessible, but does not provide services. So the continuum goes from least amount of services to most amount of services. And I think, you know, talking about our mission and our facilities is meaningless unless you meet the people who live in our communities. And Harold, okay, don't tell anyone, but Harold is one of my favorites. He's just an amazing young man. You know, you could read a quote that he gave us, but he is so appreciative. He unfortunately, at an early age, in his early 20s, became a quadriplegic through a diving accident. He will tell you that he was a silly young guy who did a silly thing, and it you know, it led to the situation that he's in now. But I hope you can see his picture and you see the wonderful artwork behind him. Although he became a quadriplegic, he became this incredible artist. He has published several books, and he's just the most positive, appreciative man. So it's just my pleasure to be able to work with individuals like that who live at New Horizons. And then we have Gary, who is a board member. He was born with CP. He's college educated. He is an avid NPR listener, and he really adds a lot of depth and dimension to all we do here at New Horizons. So just to give you an idea, and just one little mental note, that what I have learned in being here is that any of us at any time could need these types of services. So it's something that inspires me every day. So the first phase of our journey and why we're here. You know, we were on our way to exploring a social enterprise. How could we bring in earned revenues? So we participated in this series of learning labs, and I think Mike described that the Hartford Foundation, piggybacking off of what the Patterson Foundation had started, offered this great program. And we were lucky enough to be not only attend these sessions, but ultimately be chosen to have the support of Mike and Larry. So we participated in these series of earned income learning labs, which really, I think it takes a village, as we all know. We use that pun a lot because obviously we have a village here, but our board chairman, our CFO, our village manager, our director of strategic initiatives all attended these labs and really brought different perspectives so that we could make good decisions for New Horizons ultimately and where we were going to go with this venture. The labs helped us open our minds to explore a variety of possibilities. You know, we knew we had a lot of you know, services to offer, especially people who are part of our mission, but you know, we needed to narrow it down and focus. And these labs provided that focus time where we could get together and brainstorm and consider the best options for New Horizons. So what was the right earned income opportunity for New Horizons? Well, you know, we had a list of things that we thought we had interest and skill sets for. So we talked about physical therapy and occupational therapy services. We already had an outpatient service at our skilled nursing facility. We talked about renting facilities and space out. We have 26 acres here in Unionville, beautiful land, and that was a possibility. We talked about receiving stations, like for Amazon packages, whatever, because we have you know, individuals here that might be interested in working that. And last but not least, we knew there was a need for non-emergency medical transportation in the area, and we did have some recreational transportation experience. So that was clearly on our radar list. It was very important for us to leap into the venture that complemented our mission, that we felt aligned with, that we felt would help the people that we serve on a daily basis. We feel that seniors and especially people with physical disabilities are very underserved in our community, certainly, and obviously throughout the country. And we believe that you can't have a great quality of life without, services that aid them in their day-to-day living. So that was our short list, but, we chose the transportation. As you could imagine, we saw the impact of people who didn't have affordable, accessible transportation. People that lived at our facilities were missing critical surgical procedures and dialysis treatment and therapy services and other really critical life-sustaining appointments. Most of our tenants and residents have significant medical issues and missing appointments because they didn't have adequate, safe, reliable transportation was not an option in our eyes. They waited for rides. I could tell you horror stories that would make you shudder. We have a story of an individual that was left, who was nonverbal, who was left locked in a building, a medical building, until 8 o'clock at night, when finally a security guard came and found him and was able to contact us so that he can get home. I mean, there's just story after story after story, because the rides that were available just were not reliable. So there was a problem. These are, the real experiences of the people that we served. The transportation was inaccessible. People would show up with a sedan when an individual had a power wheelchair. I mean, obviously that doesn't make any sense. The drivers they were drivers, but they had no idea how to deal with people who live in a wheelchair and may have other complicated medical issues. So they didn't have experience with the mobility equipment, and the vans were not necessarily safe. So it was unacceptable. And we decided that we needed to become a part of the solution. So thanks to our Earned Income initiative, we launched Sunshine Wheels to provide reliable is the key, medical transportation, which furthers our mission in helping people live self-directed lives. And obviously it will increase and diversify our revenue stream, which was one of the original intentions for moving in this direction. The learning labs provided the framework and the space to really vet all this out. It sounds like, this is a couple minutes of explaining the process, but it was lengthy. We discussed everything. Nothing was off the table. So that was a really helpful process in coming to this conclusion. But yes, we are very proud to introduce Sunshine Wheels, and it supports the mission of New Horizons. And we do provide reliable wheelchair accessible transportation to seniors, adults, physically disabled in the Farmington Valley and surrounding areas, and now beyond. Honestly, I think, maybe after my tenure here, but I could see us moving outside the state and nationally. The need is there. We just need to grow in the right way. What's next? The second phase of our journey was to develop a business plan. We were going to be serious about this. This was going to be something that we would pursue in earnest. And so describing the business opportunity, was there a need for what we had to do? Well, that was easily answered. Obviously, there was a need. What was the model going to be like? What is our product? What could we offer? How could we do things better than the people that were out there? And then examine its viability. Could we make a profit in reality? So marketing opportunities, was there a potential market for our services? Just the numbers will show you that we came to the conclusion there's almost 400,000 people living with a physical disability in the state of Connecticut. And we're a tiny little state. 20,000 people that live just in our small Farmington Valley. We're a suburb of Hartford. And there were 2,000 trips per month that were Medicaid wheelchair trips in our Farmington Valley area. Now, Medicaid is the transportation that's operated through the state of Connecticut. Theo is the administrator, and that's how many people they transported on a monthly basis. So that was where we were going to target our market to start with. These people needed medical transportation. And again, through the Medicaid program, we were also looking at skilled nursing facilities, caregivers who would know people who needed this type of accessible transportation, and then just general community outreach, because there are also people living in their homes who could be private pay and utilize our services. We wanted to know our competitors and how we could do a better job. We had a small sense of them, but what we learned was they were clearly urban focused, where you can do a high volume in a small area. That's where you make the money, realistically. There were so many late arrivals. Clients were frustrated. And I think it stands to reason, if they were outside that high volume area, they were the ones that would wait for pickups. Also, it seemed like there was a difficulty in finding businesses that would provide this transportation. And lastly, almost all of them were for-profit, and they were motivated differently than what we felt our motivation would be. So, we could see that there was a lot of, certainly much need for improvement, and we felt that, we could provide that improvement in services for people who needed this type of transportation. We could do a better job, frankly, is how we felt. We had advantages because we already had safe, reliable vans. We know what it's like to transport people in all different types of mobility equipment. We were trusted. We had a reputation of being in the community for over 30 years. We were mission focused. We look at the needs of our clients holistically. We had a brand identity, and again, we had much experience in transportation, and the training, the knowledge, and the commitment. How do we reach our customers? What were we going to do to get the word out there? So we needed brand identity. We came up with a new logo. We actually had a contest within New Horizons. We asked the staff to come up with names. Two winners, actually we had two winners, and we combined two ideas and came up with Sunshine Wheels. And you could see the sunshine, and it kind of works well with our other logos that you can see behind me. We're all about the horizon and the sunshine and light and hope and all of that. So we're very happy with our new brand. I think it's very identifiable, and we had to work on building visibility and awareness, and people along this community definitely see and recognize our vans. They mention it to me all the time. And then sales activities, how are we going to get our clients? Obviously, we approached Theo, who was the vendor that works with the state of Connecticut for all the non-emergency medical transportation for Medicaid clients. We quickly worked with them. We became one of their preferred providers, and that was a way to move forward with getting a very good book of business on the outset. Our other business development and client outreach included working with developing relationships with assisted living facilities, other skilled nursing facilities, senior centers, doctors, as I mentioned, caregivers. These were the people that we were going to, I guess, sell our services to. So now we have to get started, a third phase of our journey. Let's get started and implement the business plan. As any new program needs, we had to come up with capital to fund the venture and to bring it to life. I tell you, this process really brought out our entrepreneurial spirit. Okay, that was a tough word. It really, and I have to say, Mike really inspired that. I don't think any of us thought of ourselves that way, but the process really was exciting. It was creative. I can't express the importance of those monthly meetings with Mike because, again, it kept us on task. The takeaways we took very seriously, and I think, as Mike could attest to, we made sure we did all our homework. We went above and beyond. We took it to the next level. It was just a positive team building experience, I guess, is the best way I can put it. And he guided us to move on to the next steps. And what I always say is I miss his cheerleading ability. Every once in a while, we have to call him for a little fix. But we look forward to that. We still feel connected, and we're able to set out and do what we needed to do in terms of raising the capital. And initially, we thought we needed 5 vans. Obviously, we needed the signage for the vans. We needed marketing materials, brochures, etc. We needed some software, and we raised not only what our original startup cost estimates were, but exceeded that. We started with the 5 vans. We now have a fleet of 13, and we would have more if we had the ability to purchase them. We actually have funding for 3 more vans, but we are on wait lists, and it could be a year, 2 years. It's a difficult thing to get right now. If anyone knows anybody that has a van for sale, I will drive to Florida. I will drive to Seattle, whatever it takes. We will give you a good price, but we do need vans to help move our transportation venture forward. So again, you can see our beautiful vans there, we just want to continue expanding the fleet. The other challenge is staffing, and everybody can feel that pain. So the things we had to do again to get us up and running, the resources we needed a dispatcher to manage the trips. We needed more drivers, always need that. We needed to track the driver's time. So we needed programs to do that. We needed resources for sales and marketing. The one thing that New Horizons did not do well historically was market. So this has actually helped us learn new tools to do that better. And we had to, of course, work with lawyers on contracts and policies and whatnot. So we did purchase our vehicles. We got tablets in each van. We upgraded our radio system for communications. I mentioned that we had to get involved in the logistics of how we were going to process payments, and of course, really ramp up our social media and website to make sure that Sunshine Wheels was highlighted. Well, our most important resource, of course, our staff, and they are the face and heart of Sunshine Wheels. I get phone calls all the time raving about them. I'm very proud of them. We kind of identified our Kelly green color, so you could spot us a mile away if you're coming out from your doctor's visit and you need to know who your driver is. There you go, Kelly green shirts. They're professional, they're kind. We don't want people working for us who don't care about what they're doing. So that was part of our branding. How did we market Sunshine Wheels? I think I kind of mentioned this. Lots of email blasts and brochures everywhere you could imagine, every senior center, every doctor's office, all of that. We did press releases through the local newspapers, radio interviews, actually some public TV spots, social media. We took it to the next level. That's not an area we were strong in either. Trade show events, associations. Lots of signage. Again, our website, really, we added a whole new dimension to the website. And, we put it on all our email signatures. Everything we sent out had a nice new shining spot for Sunshine Wheels. And I showed you the uniforms that our staff wear. Turns out, though, I must say marketing was easier than I thought, because between our reputation and the service, honestly, people wanted us more than we could, provide the service. So we're very fortunate in that respect. But you can see what we did with the website. We tried to get, purchase everything we could so that we would always come up at the top when people Googled accessible transportation. We believe that, one of our tools, our strongest tools, is telling the story. stories are the most impactful way of getting the message across. So we shared a lot of testimonials on social media. And I think they were testimonials that people could resonate with. You know, you could see me here. This was at the Travelers Golf tournament that happens every year in Connecticut. It's their Birdies for Charities event. We were recipient of money from them, but we, again, newspapers, trade associations, public TV, etc. We got our faces and name out there as much as we could. That became a big part of my daily life. So our strategy for growing our social enterprise was, you know, we wanted a clear path, a guide, and you could see we had different phases. We thoughtfully increased our business. We wanted to make sure that customer service was the most important priority. And we would grow as a result of that. And that's really what happened. So we started with our own clients at New Horizons Village and at our skilled nursing facility, Cherrybrook. And then we moved on to other facilities in the general area, and ultimately out to towns and assisted living facilities, daycares, and people just living in houses who live in wheelchairs and needed this type of transportation. As in, you know, any marketing tool, you need to maintain relationships. We kept talking and talking, frequent communications in all different ways. We sent out appeal letters, which helped us purchase vehicles. We have not paid for one of our vans. Every van has been funded to date. You know, a lot of newspaper information. We had events here. We wanted people, the more people we can get here to come and see, whether it was, you know, government officials, donors, neighbors, you name it. We wanted people to see what we were doing. And e-blasts, you know, to everybody. We got a lot of mailing lists, and we were able to send a lot out in those email blasts. So to continue to improve and grow is really important to us. So that's the fourth phase of our journey, and tracking and monitoring our progress, what we can do better, what direction we need to go in. You know, we haven't followed the business plan perfectly, although, you know, when I look at where we are versus what the plan said, we've done pretty well with being on target, but we've actually expanded some of our ideas. We always are identifying new markets, our financial mission goals, new markets, and the possibility of serving them well. We have addressed challenges. I mean, I think Mike mentioned it in the beginning. Obviously, nobody expected COVID, that little thing that kind of kept everybody locked in, and doctors basically were not taking medical appointments. So Sunshine Wheels, big part of their business was transporting people to non-emergency medical appointments. So needless to say, we had to, you know, kind of pivot a little bit. We certainly had to outfit our vans to address COVID, masks and temperatures and disinfectants and partitions, and, you know, only taking one person in a van at a time. And all of that really ate into our business in terms of revenues. We survived it, and we're, you know, on track to exceed what our projections are for this year, but definitely it slowed us down for a while. But we learned and adjusted, and I want to mention that we used surveys, customers and facilities. We still do that regularly, and we take those very seriously and learn from the survey results. And I'm happy to say that the results are, I would say, 99.9% positive, and that's the way we're going to keep it. Our revenues generated to date are about over $750,000. The number of rides that we have provided, which is probably one of the numbers I'm most proud of, because that's what this is all about, getting people where they need to go, over 14,000 trips. Again, keeping in mind COVID, that number could be a lot larger. We currently serve about 1,000 clients throughout 19 facilities, and wish we could do more if we can get drivers and vehicles. You're hearing my common theme over and over again. And locations, we now have 3 different locations. We not only have our kind of Farmington or Unionville, Connecticut headquarters, but we have 2 different locations at different facilities, so that we can serve people further out of the greater Hartford area. VEO, which is again the vendor that works with the state of Connecticut for Medicaid individuals, has named us #1 provider for their service. So I'm very proud to mention that. I feel like I'm bragging a little, but it's easy for me to do with Sunshine Wheels. We've received financial incentives and awards from VEO as a result of this honor. I have been invited to the Women in Transportation group, which is a national group, to discuss how we got involved in this. There's just been a lot of peripheral, I think, as Mike would call it, the ripple effects because of our recognition. But most importantly, as this says very simplistically, our clients are happy with the service, and they're getting where they need to go, and they're getting there safely, and they're getting there on time, and they're getting whatever service it is that they need medically. So we are using our revenues from this to boost our mission. We're using the proceeds from Sunshine Wheels to provide programs and other services that we might not be able to do had it not be for this additional revenues that we received. So it has clearly impacted our mission. In the future, I'm just going to add one last thing. We hope that we're always thinking, we never rest on our laurels. How can we improve? We would like to have more locations. We'd like to possibly brand our license our brand maybe to other states, do some consulting work. And we're really looking forward to funding arrangements, maybe with some private foundations or other funding sources that will provide payment for people who are not in the Medicaid system, perhaps people who do live in their homes and are wheelchair bound and need this accessible transportation, but can't quite afford it. So those are the things we're looking at, but it's all been an exciting journey. Any questions?
First of all, Carol, I just want to applaud you for sharing your story. It's certainly an inspiring one for a lot of reasons, and also just the fact that you went through, a process to conceive of these possibilities, and then ultimately, launch a brand new enterprise. This did not exist 4 years ago, and to have gone as far as you have is quite remarkable. So yes, maybe with that we could open it up for any questions that folks would like to ask you. Was there anything in the chat box, any comments or questions as we were going through the session? Number one, and number two, if anybody just wants to raise your hand, we can call on you, and you can feel free to ask Carol any questions. Mark. Just need to unmute yourself.
Can you hear me?
Yes.
Hi, Mark.
So, Carol, thank you for the presentation, the great information. And I'm proud of your success and wish you continued success in your endeavors up there. My question is, what did you find to be like a effective way to communicate your need to raise capital to the people that you needed to raise capital from?
I think our stories were powerful. I mean, our mission is to serve individuals so that they can live self-directed living. And I think it was very easy to explain that without access to adequate medical care, one cannot self-direct their lives. And just as I explained, instances of how people were not able to get this consistent, reliable transportation so that they could maintain their health. We explained the need for this and how other organizations were failing failing our clients and not being able to provide this. And we had a list of examples. So I think it was very compelling. The stories we had to tell were very compelling, very heartfelt. It was hard for people to hear these stories. And we had individuals that live at our facilities talk about it. You know, bringing in the people that are affected by this really helps funders understand the need.
Okay, thank you.
You're welcome.
I saw there was a couple of questions from Stephen Ray. Stephen, are you there? Would you like to unmute yourself and just ask your questions?
Sure. Carol, congratulations. It really is a fascinating, and I appreciate seeing and seeing the marketing efforts and how you have promoted that. I do have 3 questions. One of them is, did you guys have a review to see if this would be falling under the unrelated business income things, and so this could be part of your core mission as part of that earned income?
Right. So the first answer is yes, and it is not unrelated business income. I am by profession, I'm a CPA, so that didn't hurt in this process. But no, it is purely in line with our mission. It is not unrelated income, so that made that part of it much easier, as opposed to pursuing rental income for our beautiful on our beautiful campus. That would have been unrelated business income. So
excellent. And also I have a kind of a combination of other questions. Is the core infrastructure of Sunshine Wheels part of New Horizons? So are your HR, admin, financial functions a part of that? Or do you separate those differently? Or is it just a part of your mission? It just happens to be an earned income part of it.
oh, no, that's a really good question. So New Horizons Inc., there's one EIN number, one company, and then what you see underneath here are the divisions. So I mentioned Cherrybrook, our skilled nursing facility, New Horizons Village, which is a housing facility for people with physical disabilities, and New Horizons Middlebury. Sunshine Wheels comes under New Horizons Village. It made sense to house it here on our 26-acre campus. We already had a few vans for local recreational transportation. We already had a bit of an infrastructure that understood transportation on a recreational level. And so we felt that we had the opportunity to expand that here for our earned income venture.
Excellent. Thank you.
You're welcome.
Any other questions for Carol? Carol, I do have one question for you, which is, now that you've been through all of this, hindsight's 2020, but you've launched a successful earned income venture. You built it, essentially from scratch. So do you have one piece of advice, having been through all of this, that you can share with, the leaders and folks who are on the session?
Well, maybe my one piece will be a few different little things. Hard to narrow that down, but first of all, I would say, do something that you think you can do well and that is meaningful. I mean, I felt like everybody that was going to be involved in this, from the board to, to my leadership team, to the staff that would actually, make this happen when it was time to implement it, were on board with it because they knew how powerful and how meaningful and how important it was. So it was very easy to get buy-in. So you need buy-in, and for me, it was easy based on the nature of what we were doing. And also, you have to stay on task. I mean, I'm fortunate to have a team that is, again, very, very high functioning, very, very mission oriented, very creative minded, to take on projects and really could manage them very well. Definitely count on a lot of project management and dedicate important time to good project management.
Good. Well, thank you, Carol. Again, we appreciate you taking the time to share your story, the process you went through. And I guess at this point, we'll move on to sort of the final part of today's session. So I'm going to turn it over to you, Larry, and I'll share my screen again and bring up the slides.
Welcome again, everyone. And thank you, Carol. Carol did such an amazing job kind of sharing the process that she went through, the phases of work, And just thank you for that. So what does this all mean for you, and how does it relate to you, those that are on the call today? Let me dive in and talk about that. So Margin of Mission Ignition, again, is a Patterson Foundation initiative around earned income ventures. So whether you have an earned income venture that you want to grow, or whether you would like to start an earned income venture, this is a place to be. Let me talk first about kind of that boosting revenue and increasing mission impact. As Carol said, keeping it mission focused is important. Again, so we really try to focus you in that direction through the lab series as we move it forward. So mission focused impact. Carol mentioned the lab series. There are 4 labs. There are 4 earned income labs. Each lab is a month apart. Mike, if you want to change the slide. They're each a month apart. There's a little bit of homework that takes place between each one of those labs. The first lab is in September, on September 28th. I'll share more about that in just a minute. And after lab 1 and 3, Mike and I will spend about an hour with each of the teams that are participating in the labs, talking about kind of what is your earned income idea, kind of brainstorming additional thoughts around that, and kind of moving it through our process. So hopefully by the time you get to lab 4, you have a really good idea of what that earned income might be, that venture might be, or again, maybe it's something that you're already doing that you want to grow and expand upon, but you just haven't done a business plan around. So that's a lab series. It begins in September. But at the end of all of that, the results are really valuable learning and tools. And what we have learned is those organizations that go through that, as Carol said, there's ripple effects that take place throughout the agency because you learn things through those lab series, including some staff members and a board member along the way. So as you know, if you've worked with the Patterson Foundation in the past or been involved with any of the initiatives, there's usually more. So at the end of the lab series, and if you have that desire to delve deeper into this work and take it to that next level, as Carol and her team did, we offer that intensive consulting. So Mike or I will spend a few months with you helping put a business plan together. You'll do a bit of a fast pitch in between business planning and business plan implementation. So there were some questions about Carol and fundraising. We actually have a process to take you through where we help you with that fundraising. Then we dive into business plan implementation. It's really where the rubber hits the road. We'll spend a few months with you on a weekly basis, diving into that. And then we'll spend a couple of years with you in tracking and monitoring. And as Carol mentioned, those monthly calls and tracking and monitoring are really important. We have learned that just staying in contact with you and asking good questions, and you might have some concerns or some issues going along, we can help you work through that. So that's the intensive consulting piece of it. So after you make it through the lab series, you have an opportunity, if again you so desire, to move into the intensive consulting piece. Here's a number of organizations in the 4-county region that have gone through this pretty much entire process with us. And as you saw from the list of different type of earned income ventures, many of them came out of one or more of these groups. So please, if you know any of the CEOs of these organizations, reach out to them, ask them what it was like for them, ask them what difference it's made in their organization. And hopefully you'll hear a very positive story, as we do. Those are partners in the community. So let's talk about the labs. The first lab is on September 28th. It will be in person. The second lab, the third lab will be virtual. You have those dates, October 19th and on November 16th. And the last lab in December will be in person again. So I won't go through the details of each one of these labs, but those are the dates. The first one is in September 28th. Definitely mark that on your calendar. You'll receive a follow-up email tomorrow, actually, to register for that first lab. And we encourage you to do that quickly. And hopefully not just you registering as a CEO, but include a staff member or two and a board member. The more that you can participate in this process, the better the outcome will be and the more discussion you can have internally. Today's session is being recorded. You'll get a copy of that, a link to that recording. You also get a copy of the PowerPoint slides. And we encourage you to share the recording and share the PowerPoint slides again with some staff members, board members that you want to get interested in earned income or to move forward in this journey with us. But if you're so inclined, you can register right now. So if you have your phone and you want to scan the QR code, it takes you directly to a registration link. We'll be interested to see how many registrations we get right after this call. But there's a QR code. If you're not inclined to do that, you will get the email tomorrow with the registration link. And we really do encourage more than just a CEO to come to the first lab. Our CEO series continues. So for the next 3 weeks, we have 3 outstanding presenters that will share their earned income story. So we encourage you to bring a staff member or a board member along with you, share the email link or the Zoom link with them. Next week, Mike Mansfield from Habitat for Humanity will be sharing his story, the process they went through, how they chose it, and kind of what their outcomes are right now. So please keep this in mind. Hopefully you'll join us for the next 3. And again, thank you, Carol, for participating today. It was outstanding. So if we can open it up for any questions about the lab series or MMI. You can open it up. Thanks, Mike. Any questions right off the bat? You want to raise your hand or unmute yourself?
I just want to wish everybody the best of luck with however they move forward with this. It's really an exciting time.
Thank you, Carol. Any questions?
Yeah,
All
this
right.
is Fred Leonard. I
Go ahead.
did raise my hand with the tool there.
Hi,
And
Fred.
talking about the hello, and I really appreciate the presentation and putting this whole series together. And my question is related to both the labs, the 4 labs, and then the intensive consulting down the road. What kind of fees are associated with that process?
Great question, Fred. For the organizations that participate, there are no fees. The Patterson Foundation covers 100% of our time moving forward. So your cost associated with it will be the staff time that your organization puts into it. But the Patterson Foundation will cover all of our consulting time for each phase of the work. So there's no cost to you.
Okay, fantastic.
Hopefully that's a good hopefully that's the response you wanted to hear.
Yeah,
right?
that is perfect. Thank you.
Other questions? All right.
Larry, I saw that there was a comment in the chat box that the registration may have a glitch at the moment. So I think somebody behind the scenes is working on it. So if you did try to register and you had an issue, be on the lookout for the actual link for registration.
Well, first of all, thank you for trying to register using the QR code. We apologize for that, but that's exciting. Somebody's tried to register right away. Mike, do you want to open up or put the last few slides back up?
Sure.
So a couple of other resources. The Patterson Foundation has a Thrivability page, and there's a couple of pages around MMI. You can go in and you can read some stories. You can look at the blogs that have been done over the years around MMI. You can also follow us on social media, Twitter, Facebook, and Instagram. Again, my name is Larry Clark, and you met Mike Coxman. There are email addresses. You'll get those again tomorrow in the slide deck. But if you have any questions, please reach out to us, email either or both of us, and we'd be happy to respond and answer your questions. And your participation is greatly appreciated today. Thank you for taking the time. Hopefully we'll see you on September 28th and for the rest of our CEO series. And again, thank you, Carol, for participating today, and thank the Patterson Foundation for supporting all of this earned income work. So thanks, everyone.
Thank you all. We appreciate it.
Bye.
Take care, everyone.